I spoke about all the cardiovascular risk factors. This is common for both males and females, but there's a defining period in a woman's life where their cardiovascular risk factor increases. And this period is called menopause. When you stop having menses, the definition of menopause is no menses for a year. And that increases the risk factor because you lose the female hormones called estrogen. And we know there's a lot of data to show that estrogen is cardioprotective. Whatever I spoke about plaque deposition inside, estrogen helps to keep that at bay. It prevents that. But the moment you menopause, the estrogen levels go off a cliff suddenly and you start increasing your risk profile. There are a lot of other changes that happen during menopause. Your previously controlled blood pressure, which is well, your previously controlled weight, which is in check, your sugar metabolism all changes, and your cholesterol can become higher. You can get pre-diabetic or diabetic. You have central obesity that happens. And that's why menopause is important to take stock of your health. I always tell my patients, if a lady has been so busy with their life, with the kids, with the family household, menopause is a good time to take stock of your health if you never had chance before because of all these changes. And if you had the opportunity to look into your health much earlier, it's good to control your cholesterol, your blood pressure, your weight before menopause so you can ride into menopause with already good controlled risk factors so you don't have the compounded effect that happens during menopause. A lot of symptoms that we speak about is chest pains and breathlessness and sweatiness, but it is known in female patients the presentation can be atypical. It's not your classical textbook description. So I've had patients with fatigue, easy fatigue, always feeling more tired than usual, or poor sleep, or increased irritability, or low mood. Can be an underlying sign of cardiovascular disease. And the reason why females present differently is because their body makeup is different, their perception to symptoms can be different. The cardiovascular organ, the size of the vessels, the size of the heart is different. And that's why some of these things have been postulated to say why women don't present as typically as men. And as a doctor, I have to be vigilant about this because sometimes we brush off symptoms and say it's non-specific. Don't worry. But it could be underlying sign, and that's why it's important to just be very vigilant about such presentations. Most of the patients will touch base with their primary care physicians, right, to have an idea, an inclination, a sense as to what is happening to them. And most of the time, the basic test includes a full blood panel to look into your cholesterol, to look into your sugar, your thyroid, because sometimes even thyroid disease can cause some of the symptoms. And if the symptoms do not get better, yes, they can try the antidepressants, hormone replacement therapy, because some of the symptoms which I mentioned about menopausal ladies and cardiac disease, they are symptoms of menopause itself. So how do you decide whether there's a cardiovascular angle to that? So you can try some medicines, but if the symptoms don't improve, generally sometimes they refer these patients to me, and then we have some cardiac tests that we can do. We can do an EKG to look at the electrical supply. We can do an ultrasound to look at the chambers, the walls, the valves. And to look for cardiovascular disease, we have things like putting you on a treadmill, put you to a stress test, and see whether there's any problems that are seen during a stress test. And worst come to worst, sometimes we even have CT scans of the heart where you don't do a stress test, you go through a CT scan machine and they can reconstruct the heart, like a picture over here, to give a 3D analysis of what's happening in the blood supply of the heart. So it's an index of suspicion. It's very hard to give this as a general prescription to everyone out there. But and it really depends whether you've got family history or your basic screen is abnormal. So we use all these things to form a judgment. And then we take the judgment forward and see whether you need more tests.